We all know enzymes are, well, incredible. These tiny biological catalysts making everything happen inside us. But just knowing that they work isn't quite enough, is it?
Not if you really want to understand health and disease.
Exactly. How do they actually function? How do we measure what they're doing? And crucially, what happens when things go wrong? Or, when we try to intervene with medicine?
That's the core of it.
Okay, so today, let's really unpack this. We're doing a deep dive into enzyme kinetics. We'll explore how we quantify enzyme activity, look at the ways different substances can help or hinder them.
The inhibitors and activators?
Right. And we want to translate those, let's be honest, sometimes intimidating biochemical plots into things that make sense clinically. We've got some great sources here, clinical vignettes, core biochemical principles to really connect the dots for you.
Yeah, our mission today is really to cut through the jargon. Things like CAN-M, Vmax, those Lineweaver Burk plots. We want to go beyond just defining them.
And show why they matter.
Precisely. Why they matter in real-world medicine and biology.
Yeah.
What's fascinating here is how these seemingly abstract concepts have direct impacts on everything, from how your muscles work to how a specific drug actually does its job. It's not just what they mean, but the clinical weight they carry.
Absolutely. Expect some real aha moments today. By the end, you should feel like you've got a much more practical handle on this biochemical dance happening inside all of us and how we can sort of strategically influence it. So first things first, let's lay down the basics for measuring enzyme performance. When we talk about how well an enzyme is doing its job, we really focus on two key numbers, Vmax and Qmax.
Right.
Vmax, it's like the enzyme's top speed, isn't it? The absolute maximum output when it's just flooded with substrate, working flat out.
That's it, exactly. Vmax, maximum velocity. It's a measure of the enzyme's inherent catalytic power. How fast can it possibly go under ideal conditions? And if we connect this to the bigger picture, a higher Vmax usually means you've got more active enzyme molecules around. Or maybe the enzyme itself is just, faster, more efficient. It's the enzyme's speed limit, basically, dictated by how quickly it can process stuff once all its working parts, the active sites, were busy.
Got it. Speed limit. Then there's CRAM, the Michaelis constant. And here's where it gets really interesting, I think, especially for clinical stuff.
Definitely.
CRAM is defined as the substrate concentration you need to reach half of that Vmax, that top speed. I always think of CRAM as being sort of backwards, like it's an inverse measure of how much the enzyme likes its substrate, its affinity.
That's a really good way to think about it. A low CRAM means the enzyme has a high affinity. It grabs onto its substrate really tightly, even if there's not much around. It gets to work efficiently, even at low concentrations.
Okay, low CRAM, high attraction.
Right. And conversely, a high KILM means low affinity. The enzyme is a bit more, shall we say, selective. It needs a whole lot more substrate floating around before it really starts working near its potential. It's all about how tightly that enzyme and substrate hook up. And this difference is absolutely vital in metabolism.
And you see this play out perfectly with how our bodies handle glucose, right? That classic example.
Oh, absolutely. Perfect example. Take hexakinase. It's in most of your tissues. It has a low kynarin for glucose.
High affinity.
High affinity. So it snaps up glucose efficiently even when your blood sugar is low, like when you're fasting. Ensures your cells get the basic energy you don't need.
Makes sense.
Now, contrast that with glucokinase, mostly in the liver and pancreas. It has a high chimer for glucose.
Low affinity.
Low affinity. So it only really kicks into high gear when glucose is plentiful, like right after you've eaten a meal.
So it doesn't hog all the glucose when levels are low.
Exactly. It prevents the liver from grabbing all the glucose when other tissues might need it more. And in the pancreas, it helps trigger insulin release when sugar is high. It's really smart design. I mean, imagine the implications if these were swapped. Total chaos.
Yeah, you'd either starve yourselves fasting or be overwhelmed after meals. Okay, so we have Vmax and Chimentums, and we can see them on those Michaelis-Menten curves, but you mentioned plots. Sometimes those curves aren't the easiest to, nail down exact numbers from, especially if something's changing.
Right, they're hyperbolic. You can be tricky to pinpoint Vmax accurately just by looking.
And that's where the Lineweaver-Burk plot comes in, our diagnostic tool.
That's the one. It's a clever trick, really. The Lineweaver-Burk plot takes the reciprocals. It plots 1 over the velocity against 1 over the substrate concentration.
So 1V versus 1X?
Exactly. And doing that turns that tricky curve into a nice straight line, which is much easier to work with.
And the intercepts tell us something important.
They tell us everything. The y-intercept, where the line crosses the vertical axis, is equal to 1 divided by Vmax. And the x-intercept, where it crosses the horizontal axis, is equal to -1 divided by Qmax.
Okay, so you can just read Vmax and column map right off a graph, essentially.
Pretty much. And the real power, especially for clinicians or researchers, is how quickly this visual lets you see what's going on. Is a new drug competitive? Non-competitive? You can tell almost instantly by how the line shifts compared to the normal enzyme. It's super useful.
Okay, so we've got a baseline for how enzymes work and how we measure it. But let's get into the interference. What happens when something gets in the way? Inhibition. This is where so many medications, and unfortunately toxins too, come into the picture.
Right. This is pharmacology 101 in many ways.
Let's start with what feels like the most direct kind competitive inhibition, like a turf war for the enzyme's active site.
That's a perfect analogy.
Yeah.
With competitive inhibition, you have an inhibitor molecule that chemically looks a lot like the enzyme's natural substrate.
Similar shape. Similar enough that it can actually bind to the same place, the active site. So it directly competes. If the inhibitor gets there first, the substrate can't bind. It's a competition for that critical spot.
But can you overcome it? If you just absolutely flood the system with the real substrate, can you win that competition?
You can. And that's the defining feature. Because it's a competition, if you dramatically increase the concentration of the actual substrate, you basically outcompete the inhibitor by sheer numbers.
Okay.
So the effect on kinetics is this. The parent KMM increases. You need more substrate to reach half the maximum speed because the inhibitor is getting in the way.
Makes sense. You need more substrate to win the race.
Exactly. But, and this is key, the Vmax itself stays the same. If you push the substrate concentration high enough, the enzyme can still eventually reach its maximum speed. The inhibitor just makes it harder to get there.
And on our Lineweaver Burk plot, what does that look like? On the plot, the line pivots around the y-intercept. The x-intercept shifts to the right, becoming less negative, which shows that higher apparent Kiramin. But the y-intercept, that's 1 Vmax, stays put. Vmax is unchanged.
Ah, clear visual cue.
Very clear. Think about statins, the cholesterol-lowering drugs. They're classic competitive inhibitors of an enzyme called HMG-CoA reductase. They compete with the natural stuff, but theoretically the enzyme could still work at full speed if enough precursor was around.
Okay, competitive fights for the active site, increases Kiramin, Vmax unchanged, can be overcome. What about inhibitors that play dirty that don't go for the active site? That's non-competitive inhibition, right?
That's right. These guys are different. A non-competitive inhibitor binds to the enzyme at a totally different location, not the active site. We call it an allosteric site.
Okay, so it's not competing for the main spot.
Nope. But binding there causes the enzyme to change its shape, its conformation. And that change makes the enzyme less effective at doing its job, or sometimes it essentially takes that enzyme molecule out of commission.
So it reduces the number of working enzymes.
Effectively, yes. The net result is that the Vmax decreases. There's just less functional enzyme capacity available. But interestingly, the calamion stays the same. The remaining active enzymes, the ones not affected, still bind the substrate with their normal affinity.
And crucially, you can't overcome this one by just adding more substrate, can you?
You cannot. Flooding the system with substrate doesn't kick the non-competitive inhibitor off its separate binding site, so Vmax stays low.
So how does that show up on the Lineweaver-Burk plot?
Here, the y-intercept moves up. Remember, y-intercept is 1 Vmax, so a higher intercept means a lower Vmax. But the x-intercept, which is 9.1 kilometers, stays exactly the same. The lines will intersect on the x-axis.
Distinct pattern again.
Absolutely. You see this with certain drugs, or sometimes, unfortunately, with irreversible inhibitors. Things like organophosphate pesticides, they permanently knock out enzyme function. Kinetically, that looks very similar. Vmax goes down, Calumet stays the same.
Okay, 2 down. Competitive, non-competitive. Then there's this other one, uncompetitive inhibition, which always felt a bit unique. It waits for the party to start.
Huh. Yeah, that's a way to put it. It's quite different. An uncompetitive inhibitor doesn't bind to the free enzyme at all. It only binds to the enzyme after the substrate is already bound. So it binds to the enzyme-substrate complex.
Only to the ES complex. Okay, what does that do?
By binding to that complex, it sort of traps it. It prevents the product from being formed and released efficiently. And because it's essentially pulling the ES complex out of the reaction pathway, it looks like the enzyme has a higher affinity for the substrate. It lowers the apparent Calamina, but it also lowers the maximum velocity, Vmax, because it's gumming up the works later on.
So it affects both. Both Calamim and Vmax go down.
Correct. Both apparent Calaman and Vmax decrease.
And the Lineweaver-Burk plot for this one must look pretty different then.
It does. It's very characteristic. You get a series of parallel lines. The slope, Cam Vmax, stays the same because both are decreasing, but the intercepts shift. Parallel lines are the dead giveaway for uncompetitive inhibition.
Parallel lines, got it. Okay, one more main type, mixed inhibition. Sounds like, well, a mix.
It is. Mixed inhibitors, as the name suggests, mess with both substrate binding and catalysis. They can bind to either the free enzyme, like a competitive inhibitor but maybe not at the active site, or the enzyme substrate complex, like an uncompetitive inhibitor.
So they hedge their bets.
Sort of. Because they can bind in both states, they always decrease the Vmax. There's less effective enzyme action overall, but the effect on chimerism is variable.
Ah, so chimerism could go or down.
Exactly. It depends on whether the inhibitor prefers binding to the free enzyme or the enzyme substrate complex. If it prefers the free enzyme, it increases the apparent chimerism. If it prefers the ES complex, it decreases the apparent chimerism.
Okay, so Vmax always down, chimerism maybe, and the plot.
On Lineweaver Burk, the lines will intersect, but not on either axis. They'll intersect somewhere off-axis in the left quadrant, usually. Both the slope and the y-intercept change. It's another distinct visual signature, different from competitive or non-competitive.
Right, so those plots are really powerful for figuring out how an inhibitor is working. But inhibition isn't the only story, is it? Sometimes the problem isn't something blocking the enzyme, but the enzyme itself, like in genetic conditions.
Absolutely. That takes us into enzyme deficiency. This is often the root cause of many inherited metabolic disorders.
So what happens kinetically if you just don't make enough functional enzyme?
It's fairly straightforward, actually. If you have less enzyme due to a genetic mutation, your total enzyme concentration is lower. Kinetically, this means your Vmax is decreased. There are simply fewer workers on the job.
Fewer enzymes, lower top speed. Makes sense. What about kinome?
The camera usually stays the same. The few enzyme molecules that are produced are often perfectly normal in terms of their structure and how they bind the substrate. Their affinity isn't necessarily affected, just their quantity.
So low Vmax, normal kinome. And we see that in real patients.
All the time. Think of a young adult presenting with muscle weakness, maybe high lactate levels after exercise, due to a problem with a mitochondrial enzyme, or a child with developmental delays because of pyruvate dehydrogenase deficiency. Often, the kinetic finding is decreased Vmax, normal quantity. It points towards a problem with the amount of enzyme, not necessarily its binding ability.
Okay. And what about the flip side? Sometimes we actually want to boost enzyme activity, right? Not inhibit it.
Yes, absolutely.
Yeah.
That brings us to allosteric activation. Similar to non-competitive inhibition using an allosteric site, activators can also bind to these other sites.
But instead of slowing things down, they speed them up.
Exactly. Binding of an allosteric activator causes a conformational change that makes the enzyme more active or efficient.
And how does that look kinetically? Does it change Vmax or Kmin?
It can do either or both, depending on the specific enzyme and activator. Some activators might primarily increase Vmax, making the enzyme work faster without changing its affinity. Others might decrease the chimerism, making the enzyme bind its substrate more readily. Sometimes you see effects on both. The key point is enhancement of activity.
Right. So inhibition slows things down. Deficiency means less enzyme. Activation speeds things up. Now, here's where it gets really cool, I think, weaving several of these threads together. Let's talk about that homocystinuria case, the cofactor responsive kind.
Ah, yes, this is a fantastic example. It really highlights the nuance. So homocystinuria is a condition often caused by a problem with an enzyme called cystathionine VOS synthase, or CBS.
Okay.
Now, some patients with this condition get significantly better if you give them high doses of vitamin B6, pyridoxine.
That's the clinical clue. What's happening biochemically?
Well, researchers might test the CBS enzyme activity in cells from these patients, and maybe they find it's, say, only 5% of normal activity. Looks like a severe deficiency.
Very low Vmax, presumably.
Right. But then here's the key step. They add high concentrations of pyridoxal phosphate, which is the active form of vitamin B6, right into the test tube with the patient's enzyme, and suddenly
The activity goes up.
it normalizes
Yeah.
or gets very close to normal.
Wow. So the enzyme isn't just broken.
Exactly. It tells us the mutation isn't in the core catalytic part of the enzyme. Instead, the mutation affects how well the enzyme binds to its essential helper molecule, its cofactor, PLP. It has reduced affinity for the cofactor.
Ah, so it needs way more cofactor around just to function properly.
Precisely. This is what we call a cofactor responsive enzyme deficiency. The enzyme can work, it just needs a pharmacological boost of its cofactor.
So how does that translate to our Lineweaver Burk plots? This seems complex.
It seems complex, but the plot tells the story beautifully. Without added cofactor, yes, you see a very low Vmax, the line is very steep, high y-intercept, looks like a standard severe deficiency. But when you run the test with high levels of the cofactor, PLP, the activity normalizes. That means the Vmax returns to normal, or near normal. And usually, The chemome for the substrate remains relatively normal too because the primary defect was cofactor binding, not substrate binding.
So the line shifts dramatically.
It essentially overlaps with the line for a normal healthy enzyme when that cofactor is present in high amounts.
That's incredible. And it really drives home how important the conditions of the test are. With cofactor versus without cofactor gives completely different kinetic pictures.
Completely different interpretations, and critically, completely different treatment approaches. One suggests maybe enzyme replacement, the other suggests high-dose vitamin therapy. Kinetics gives you that insight.
Okay, this is a lot to keep straight. Competitive, non-competitive, uncompetitive, mixed, deficiency, cofactor responsive. To help everyone listening wrap their heads around this, we came up with a little mnemonic.
Ah, yes, the mnemonic.
Vicky's cats never meow much. Silly, but hopefully sticky. Can you walk us through how that helps?
Sure thing. It's a quick way to recall the main effects on Vmax and Km. V is for Vmax decreased. Think enzyme deficiency, like the PLP unresponsive kind or just less enzyme. Vmax is down, Km is often normal.
D for Vmax down. Oh.
C is for competitive. Remember, they compete. Km is up, need more substrate, but Vmax stays the same.
C for competitive, Km up.
N is for non-competitive. Vmax goes down, less active enzyme, but Km stays the same. Affinity isn't directly hit.
N for non-competitive, Vmax down.
The first M is for mixed. Vmax always goes down, Kmn, well, it's mixed. It can go up or down.
M for mixed, Vmax down, Km a variable.
And the second N, we use that for our special case, the cofactor responsive, PLP responsive type, like the homocystinuria example. With the cofactor, activity is restored, so Vmax looks normal, and Km looks normal.
Km, mostly normal if cofactor is present. Vicky's cats never meow much. Hopefully that helps you keep the pattern straight.
Yeah, maybe just a couple of quick final tips for recall. If Vmax changes, think about the amount of working enzyme or its fundamental speed. Something is affecting capacity. If Kinome changes, think affinity. Something is affecting how well the enzyme grabs its substrate.
Makes sense.
And if adding a cofactor fixes things, think cofactor binding defect. Vmax normalizes, Knon is usually okay.
So tying it all together, what does this really mean for you listening? Whether you're deep in research, seeing patients, or just fascinated by biology. Understanding these kinetic principles is like having a decoder ring.
It really is.
It's fundamental to grasping how so many drugs work, why genetic diseases cause the symptoms they do, even how your diet impacts your biochemistry on a molecular level.
Yeah.
We've gone from Vmax and Kane basics through all those types of inhibition, looked at deficiency and activation, and even that nuanced cofactor story. These molecular interactions happening constantly, unseen, they dictate so much.
Absolutely. And if we connect this to the bigger picture one last time, the ability to measure, understand, and then modulate enzyme activity. That's a huge pillar of modern medicine. Designing a new statin, figuring out a metabolic disorder, developing personalized vitamin therapies, enzyme kinetics provides the blueprint. It tells us how things work and how we might intervene effectively.
It really is powerful stuff. Thank you for diving deep with us today into this foundational science.
My pleasure. It's fascinating stuff. Maybe leave you with this thought. The next time you take any medication, or even just eat your lunch, think about the literally millions of enzyme reactions firing off inside you.
Wow.
How precisely tuned they are.
Yeah.
And how just a tiny shift in a Kelly value here or the Vmax there could change that whole internal symphony. It gives you a new appreciation for how resilient and sometimes how fragile our biochemistry is.
That's a great thought to end on. Keep looking at the world with that curious mind, everyone. Keep noticing these deeper layers.